Scoliosis treatment guidelines. Which option is the best for you? Scoliosis is diagnosed through a combination of physical examinations and scoliosis x-ray results. And scoliosis involves the development of an unnatural sideways bending curve that also rotates into the concavity for it to be considered true scoliosis. In addition, for there to be a curvature and rotation, there must be a minimum of 10 degrees on the Cobb angle measurement that's taken during the x-ray or measured during the x-ray for it to be considered a true scoliosis. Scoliosis is a progressive condition, and progression is triggered normally by growth or late stage progression in later stage life, but most commonly associated during rapid growth and progression. Now, there are many different ways to treat scoliosis. The two main choices when we look at the treatments for scoliosis is something that we call traditional approaches and conservative approaches, and they offer very different potential outcomes. Traditional scoliosis treatment typically offers surgical treatment after the curve has progressed to a certain point, and they consider surgery being the only option to try to manage your scoliosis. And the reality is that in many cases of scoliosis don't require surgical intervention, and particularly when it's diagnosed early, if there's early intervention. Conservative treatment works proactively to prevent progression, and if progression has already occurred, we're normally trying to reduce the scoliosis below surgical standards, so therefore surgery will no longer be an option. So when we look at this, do we consider surgery to be a good treatment option? Well, there are definitely some severe cases where surgery is necessary, but every case of surgery carries potential risks, side effects, and complications. Scoliosis surgery is a type of spinal fusion that commonly involves removing discs and bones that sit in between the vertebra and parts of the bone that sit in the back, and it fuses them. And it fuses the most tilted vertebra on the top of the curvature to the most tilted vertebra on the bottom of the curvature into one solid bone. It does this by not only putting bone grafts in between all the bones, but it also uses rods and pedicle screws to hold the spine in place while these bone grafts are taking place and healing. The goal of fusion is to stop progression. Now, even though scoliosis fusion can straighten spines to some degree, it really works against the contrary design of the spine to be flexible and movement-based in terms of spine function and health. We know that spines are designed to be strong and stable, but also movement to allow the body to function and move properly. And movement is not just physical movement, but also just spinal movement associated with normal organ function like cardiovascular function and pulmonary function. In addition to the surgical procedure itself, we know there's risks associated outside of just the spinal fusion. We know that there's infection, possible nerve damage, possible adverse reaction to the hardware, possible excessive blood loss. So when we look at spinal fusion, we know we're sacrificing one function to try to improve something else. And this non-functional approach is what a lot of patients consider inappropriate, and they don't want to go through that, so they're looking for another option. Your other option is something called conservative treatment. Now, understand that conservative treatment, when I say this, I mean modern conservative treatment that's looking at proactively treating a curve. There is traditional scoliosis conservative treatment, but it's more like doing nothing until the curve becomes big enough to do surgery. And at the most they would offer is a brace trying to slow down the progression during growth phases, where the goal of conservative treatment is aligned with the spine's normal movement based. And it's not just trying to permanently disrupt spinal health with fusion like surgery can, but it's really designed to try to reduce the curve the minute it's found and to improve function, improve mobility, improve strength. And the goal is that we're either preventing progression or reducing the curve below a certain threshold, so scoliosis surgery is no longer needed. We know scoliosis only becomes more complex as the curve progresses, so there's no benefit in watching your curve worsen. There are a very large number of benefits associated with proactive treatment. The most obvious benefit is if we keep your curve small, there's never going to be a surgical recommendation. So we know conservative treatment also integrates many different types of scoliosis treatment disciplines to help impact the spine on many different levels, on strength, mobility, function, and stability. Now, where non-surgical treatment normally doesn't involve really looking at all these different things that are normally to try to treat a scoliosis. It's normally looking at only one treatment model, putting screws and rods and into the spine to immobilize it. Conservative treatment recognizes that it's a very complex that requires many different treatment options. So patients here at the center benefit from being able to access multiple treatment modalities. I always look at the most successful scoliosis treatment to be multimodal. And this multimodal approach is what allows patients to respond to the care appropriately and allows me to use different tools to help patients respond better as they grow and also as their curve improves, so we can adjust the treatment programs accordingly. Treatments typically include very specific types of chiropractic care that can address scoliosis on a structural level. Typical office therapy and rehabilitation that includes active and passive therapies. We look at corrective bracing with serial brace modifications as the spine is improving to continue to modify the brace and make it more aggressive and effective. And then we look at home rehabilitation that's customized on a structural level, not just home rehabilitation trying to improve range of motion or strength. Now, we know every treatment option offers a different result, but which one here would be the best for you? Well, I definitely know that understanding what scoliosis is and having the knowledge to make a decision is very powerful. And when we look at treatment options, you want to definitely look at what are the pros and cons of each treatment option. It's important that people are aware that different treatment options, when they choose traditional versus conservative treatment options, that you're setting yourself up for an outcome that normally that treatment option will lead you to. And it was a time that traditional scoliosis treatment was really the only choice, and many patients really had no other options outside of just doing nothing, wearing a Boston brace to try to slow down progression, and potentially considering spinal surgery when the curve got big enough. And then as surgery has become more and more popular, and we're seeing more and more adverse effects as a result of surgery, and we know surgery can permanently alter health and function of the spine, and it's not always in a positive way. It can lead to some negative outcomes, that I feel that the risk of scoliosis surgery should be only considered after less invasive conservative treatment has first failed. Because if we treat patients conservatively first and it doesn't work, then doing the more invasive option makes sense. But what ends up happening the majority of the time is most patients are not even treated until it becomes severe enough. And then when it becomes severe, they say the only option is at this point surgery. So in the end, each patient really has to ensure that if they embark down a treatment path, whether it be conservative treatment to try to prevent surgery or traditional treatment and letting the curve progress to consider surgery later in the future, that you know the outcome is, as curves worsen, that's where we're leading to. We know every treatment that every patient experiences is unique to them, but as this being a patient's choice to treat their scoliosis, I believe in how you begin the treatment. It really depends on how you end the treatment. So if you begin it in this traditional box, doing traditional approaches, you're normally going to end more than likely in the scenario that if the curve worsens, that you're going to be recommended more severe, more invasive types of treatment options like scoliosis surgery. Where if you start in a box that the doctor is trying to prevent surgery and actively trying to reduce your scoliosis, you're more likely to end in a place that you're not going to need surgery as a recommendation. I definitely recommend don't be afraid to ask potential questions to your provider, the experience that's involved in trying to reduce your scoliosis, if that's your goal. If your goal is just waiting to see if your curve is going to progress to surgical levels, well, then you ask questions regarding that. So here at the center, we spend a tremendous amount of time educating our patients about scoliosis, the different treatment options associated with. So reach out with any questions so we can definitely put you on your scoliosis journey of good health and well-being for not only now, but really for the rest of your life. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.